Hello, I'm Dr. Emily Carter, and today we're talking about something that can feel unsettling, even frightening, especially after the age of 40. You walk up a flight of stairs and suddenly you're breathing harder than you used to. You carry groceries from the car and feel slightly winded. Maybe you're lying in bed at night and become aware of your breathing in a way you never noticed before. If you found yourself thinking, "Why am I so out of breath?" You're not alone. Shortness of breath after 40 is more common than many people realize. But here's the important part. It's not something you should automatically dismiss as just getting older. Breathing is something we rarely think about until it changes. When it feels different, it can trigger anxiety. But breathlessness can have many causes, some simple and reversible, others more serious. The key is understanding what your body may be trying to tell you. As we age, the respiratory system naturally changes. Lung tissue becomes slightly less elastic. The muscles that assist breathing, including the diaphragm and chest wall muscles, may lose strength if they are not regularly challenged. The ribcage itself becomes a bit stiffer over time. These gradual shifts can reduce how efficiently the lungs expand and contract. For many people, this change is subtle, but combined with other factors, it can become noticeable after 40. Cardiovascular health plays a major role. Your heart and lungs work together to deliver oxygen to tissues. If the heart pumps less efficiently due to high blood pressure, early heart disease, or reduced fitness levels, you may feel breathless with activities that previously felt easy. This doesn't mean something catastrophic is happening, but it does mean the body is working harder to meet oxygen demands. Deconditioning is one of the most common reasons for breathlessness in midlife. Many adults become less physically active over time. Desk jobs, long commutes, stress, and fatigue reduce movement. When the body is not regularly challenged with aerobic activity, the heart and lungs lose some capacity. Even mild exertion can feel more intense. The good news is that this is highly reversible with gradual training. Weight changes also influence breathing. Carrying extra weight increases the work required to move and expands the chest wall. The diaphragm may have less room to move efficiently. Even modest weight gain can make climbing stairs feel harder. After 40, metabolism slows slightly and weight gain becomes more common, contributing to this cycle. Anemia is another important and often overlooked cause. Red blood cells carry oxygen throughout the body. If hemoglobin levels are low, tissues receive less oxygen, and you may feel short of breath even when lung function is normal. Anemia can develop gradually and may be accompanied by fatigue, pale skin, or dizziness. Thyroid function influences breathing as well. An overactive thyroid can cause rapid heart rate and a sense of breathlessness. An underactive thyroid can contribute to fatigue and reduced exercise tolerance. Hormonal shifts after 40 make thyroid screening more relevant. Anxiety deserves serious consideration. Many people experience heightened stress in their 40s due to work pressures, financial responsibilities, or family changes. Anxiety can alter breathing patterns, leading to shallow or rapid breaths. Hyper-awareness of breathing can create a cycle where the sensation of breathlessness increases anxiety, which further disrupts breathing. Sleep quality also affects daytime breathing. Sleep apnea becomes more common after 40, particularly in individuals who snore or carry extra weight. Repeated nighttime breathing interruptions reduce oxygen levels and strain the cardiovascular system. Daytime fatigue and breathlessness may be subtle signs. Lung conditions such as asthma or chronic obstructive pulmonary disease may first become noticeable in midlife, especially in smokers or former smokers. Early symptoms can include mild breathlessness with exertion, chronic cough, or wheezing. These conditions are manageable, particularly when identified early. Heart rhythm irregularities can create episodes of sudden breathlessness. If you experience shortness of breath accompanied by palpitations, chest discomfort, or fainting, medical evaluation is important. Let's talk about warning signs. Mild breathlessness during heavy exertion can be normal. But if you experience sudden severe shortness of breath, chest pain, bluish lips, swelling in the legs, or breathlessness at rest, seek immediate medical attention. These symptoms can signal urgent conditions. Now let's focus on what you can control. The first step is awareness. Notice when breathlessness occurs. Is it during physical activity, after meals, during stress, or at night? Patterns provide clues. Gradual cardiovascular exercise is one of the most powerful tools. Walking, cycling, swimming, or light jogging strengthens the heart and lungs over time. Start slowly. Consistency matters more than intensity. Within weeks, many people notice improved endurance. Strength training supports respiratory muscles and improves overall metabolic health. Muscle tissue helps regulate oxygen use and circulation efficiency. Breathing exercises can improve lung capacity and reduce anxiety-related breathlessness. Slow diaphragmatic breathing trains the body to use the diaphragm more effectively, increasing oxygen exchange. Maintain a healthy weight through balanced nutrition rather than extreme dieting. Extreme calorie restriction can weaken muscles, including respiratory muscles, and worsen fatigue. Stay hydrated. Dehydration can thicken mucus in airways and reduce blood volume, subtly affecting oxygen delivery. Avoid smoking and limit exposure to pollutants. Lung tissue becomes more vulnerable with age, and protecting it is essential. If anemia is suspected, simple blood tests can confirm it. Iron supplementation, when appropriate, often significantly improves energy and breathlessness. Manage blood pressure and blood sugar carefully. Stable cardiovascular health protects oxygen delivery systems. Pay attention to posture. Poor posture, especially from prolonged sitting, restricts lung expansion. Standing tall and stretching the chest wall can immediately improve breathing efficiency. Sleep quality is foundational. If you snore loudly, wake gasping, or feel excessively tired despite adequate sleep time, consider discussing sleep evaluation with your healthcare provider. Most importantly, do not ignore persistent or worsening symptoms. Breathlessness is not something to fear automatically, but it is something to respect. After 40, the body begins sending more subtle signals. The difference between aging well and struggling often lies in responding early. Breathing should feel natural and effortless most of the time. When it doesn't, your body is providing information. That information might point to deconditioning, stress, metabolic shifts, or something that needs medical attention. The encouraging news is that many causes of midlife breathlessness are reversible or manageable. Improved fitness, better sleep, balanced hormones, stable blood pressure, and reduced stress can dramatically change how you feel within months. Aging does not mean losing your breath with every step. It means adapting your habits to match your changing physiology. If you've noticed that stairs feel harder or that you can't catch your breath as easily as before, don't panic. Observe, evaluate, act gradually. Small, consistent changes can restore stamina and confidence. Your lungs and heart are remarkably adaptable. Give them the stimulus and support they need, and they respond. Breath is life. Protect it. Train it. Monitor it. And remember, feeling short of breath after 40 is common, but it is never random. Listen carefully, respond wisely, and your body will often reward you with renewed energy and resilience.